I'm Bruno Paiva from the University of Navarra in Pamplona, Spain. I think we can all agree that it is very important to assess treatment efficacy in myeloma, and indeed it is one of the most relevant prognostic factors in this disease. Because nowadays C rates are so high, there is more and more interest in measuring MRD after treatment. Also, we are becoming aware that a single MRD assessment, while being extremely valuable for the patient prognostication, it may lack robustness to predict with great accuracy what will happen next, and more importantly, to help tailoring patients' treatment. This is why there is more and more interest in periodic, frequent, longitudinal MRD assessment. Now, if we aim towards frequent MRD assessment, there will be need for minimally invasive methods. There are already a few minimally invasive methods, certainly the assessment of M protein serum, and nowadays there is even a more sensitive method. Mass spectrometry may be more sensitive than immunofixation and the free light chain assay. Another minimally invasive method is PET-CT to measure disease inside and outside the bone marrow. And then we have next generation flow cytometry and next generation sequencing, NGF or NGS. These methods have been used in bone marrow. They are very sensitive. They can detect one tumor cell in 1 million normal cells, that is 10 to the minus 6. And when they are applied in blood, the sensitivity is the same, but because tumor burden in blood is lower when compared to the marrow, there are many cases that may be MRD positive in the marrow, but they are MRD negative in blood. That is a false negative. Importantly, whenever these methods are positive in blood, they do identify a small subset of patients with very poor PFS. Therefore, I envision for the future that with more sensitive NGS and NGF, we will have clinically meaningful MRD detection in blood using these two methods, either one or the other, to measure ctDNA and CTCs, and these will be complemented with mass spectrometry for the M protein and PET-CT. And I do believe that such a comprehensive MRD assessment, from the M protein to cells to imaging, performed frequently, longitudinally, will achieve much more powerful risk stratification, will increase the ability of MRD assessment to identify those patients at risk of progression versus those that may enjoy excellent outcomes, and this will be the tool that we all aim to achieve for tailoring patients' treatment.